Ladies and gentlemen, Hong Kong's median age has already risen from 43 to over 46 in just 5 years and is projected to exceed 53 by 2046. At the same time, elderly living alone households have increased by nearly 60% over the past decade. The aging challenge is accelerating, but our service systems remain largely reactive. Support is activated after hospitalization, after mobility decline, after crisis events. The real opportunity is prevention. Gerontech rental demands is growing nearly 2.4 times year to year, with annual growth around 15 to 20%. Yet, service patterns remain concentrated. Over 60% of the rentals are in mobility-related devices, wheelchairs and nursing beds. Preventive, smart monitoring devices account for barely 10% of the total rental. More importantly, elderly living alone represent roughly 34% of the elderly population, but only 19% of the rental users. That gap represents hidden demand. Low rentals do not mean low need. They often mean low awareness, outreach barriers, or accessibility gaps. Hidden Wonders Care transforms this challenge into predictive service model. Instead of relying solely on historical rental data, we integrate rental records and equipment lifecycle data, district-level aging population trends, income and household indicators, living arrangement analysis, health and vulnerability signals. This creates our district-level demand intelligence framework. We can forecast equipment demand by district, for example, nursing bed demands growth in emerging districts, rising preventive monitoring needs among elderly aged 70 to 85, underserved zones where rental density is significantly below. This enables targeted outreach in high-risk clusters, optimized inventory allocation by district, stronger hospital discharge coordination, smart monitoring pilots in silent risk communities. Instead of asking, how many rentals did we process last year, we ask, where will intervention be required next quarter? This is a structural shift in care planning. By shifting to predictive intelligence, service organizations can reduce delivery delays through district-based stock planning, improve outreach efficiency in service gap zones, allocate resources based on forecasted demand, not reactive requests, increase service coverage without proportional budget growth. Earlier intervention reduces hospitalization risk, preventive monitoring reduces fall probability, better targeting improves cost efficiency, predictive care improves both outcomes and sustainability. Hidden Wonders Care is powered by IGOTech's AI intelligence engine. Our models perform time series demand forecasting, service gap detection, risk scoring for living alone elderly, what-if simulations for outreach and capacity planning. This platform is built on scalable cloud infrastructure, supports continuous modeling, retraining, and is designed for multi-district deployment. It is enterprise-ready but socially focused. The aging challenge is not slowing down. Demand is grown 15 to 20% annually. Living alone households are rising rapidly. Reactive system will not scale. Hidden Wonders Care enables a more from reactive rentals to predictive aging intelligence. Because the future of aging at home services is not responding faster, it is predicting earlier. And prevention is the most sustainable form of care.